Maybe you have some nail changes going on that you're curious about. And one of the questions you might have is that, is this nail fungus or is this something else? How do I tell the difference? This video is about to go into all of that. My name is Dr. Tarr. I'm a board certified podiatrist in private practice in Tempe, Arizona, and I own a small private practice called Direct Podiatry Arizona. This is how you tell the difference between nail fungus and other things going on in your nail. So when people think about the words nail fungus, they usually think about nails that are thick, that are maybe white to yellow, crumbly, maybe even brown sometimes. They might even have a slight odor as well. Sometimes nails with fungus will lift, and there can be almost like a buildup underneath the nail of debris, what we call subungual debris, the medical term. Also, nail fungus can tend to spread as well. Usually it'll start in one toenail, and over time, over months or even years, that infection will spread to the other toenails. But the catch is that nails with many different conditions can look exactly the same as a nail that's infected with fungus. The mistake that people can make with this is that nail trauma, actually, if you've had any type of injury to your nail in the past, this can look exactly the same as nail fungus. Your nails can start to change colors. They can grow out a lot thicker. They can be crumbly as well. They can start to lift. They can have debris underneath. Psoriasis, an autoimmune skin condition, can also affect your nails as well and cause changes to your nails. Someone with psoriasis, how they will experience changes in their nails. Their nails could have little dents or pits in them. Usually these nails will also look white. Aging, sometimes as we move through our stages of life, your nails can actually become thicker over time. They can start to change colors. And it's not caused by infection, but simply just caused by the aging process. If you're on certain medications or you're having especially chronic health issues like diabetes, chronic kidney disease, if you have poor circulation, if you're undergoing chemotherapy, all of these things definitely can change your nails. Definitely with this category, you want to think back to maybe when you started noticing certain health problems, when you got on a certain medication, and when you notice your nails starting to change. That can kind of point you in this direction. And also, nails can be infected by yeast or bacteria. Green nail syndrome is one of the most common causes. Green nail syndrome is when bacteria, specifically Pseudomonas is the name, infects toenails, and it literally will turn your nail green. The number one way and the best way to know if your nail is infected by fungus or something else is going on is really to take a biopsy. This is pretty simple to do. You would go to your podiatrist or foot doctor's office. We would do a medical history. Make sure it's not something like trauma going on, something on your toe being dropped, your toes being run over by something. These are all patients that I've had here. Maybe your toenail got ripped out or ripped off at some point in time. Me personally, if I'm thinking that your nail changes aren't trauma related, then I'll do a biopsy. And that involves me just trimming your nail. It's very painless. If you have some debris underneath your nail, I can take that too along with the trimming and putting it in a little bag, a little Ziploc bag, and send it to a lab. And this lab will then test the sample that I send for all types of different fungi, especially for different bacteria, even different yeasts. So it's very interesting. And this is called PCR. And PCR I like to use if I'm thinking that my patient has nail fungus or even anything else that's possibly infecting their nail, just because it's super, super specific. So the good thing about this type of biopsy, PCR, is that it does give you a list of different names of fungi, different names of yeast that they're testing for. And it will let you know exactly the species of fungi or yeast that is in the sample that you sent. Why is this important to know? Because just like one antibiotic doesn't work for all the bacteria that exist, antifungal treatment doesn't work for all fungi. So it's important to know the name of the fungus, because once we know the name, then we can tailor our treatment based on that name or based on that species. There can be multiple different types of fungi, or there can be fungi and yeast, or fungi and bacteria in your nail. So this is why I really am a fan of the PCR. Today, I wanted to show you an example of a lab result of one of my patients that actually opted to get a nail biopsy done with me. Obviously, for patient privacy reasons, all patient identifiers, name, birth date will be left out. But it's pretty interesting information if you decide to go down this road, if you want to treat whatever's going on with your nails, fungus included. So we'll go over it right now. So I had a patient that came to me. They actually came wanting Cariflex. I plan on doing a video on Cariflex in the very near future. So that is a nail restoration system, only can be purchased by doctors and other professionals, used for nails that have been damaged by fungus. He had been dealing with toenail issues for about 2 decades, and they kind of just wanted something to give a better cosmetic look to their nails. But also at the same time, they talked about their history, thinking that this could potentially be fungus. And again, I stress the best way to know, especially if you're interested in treatment, is for me to take a biopsy. So I agreed to that, sent it off to the lab, still applied the Cariflex, and in about a week, I got their results. I have my iPad here, so pardon me if I'm looking down, but this is what I'm looking at. So the first page, patient information, my information, and this is really an overview of what I ordered. Again, the PCR, the most specific and sensitive test you can order if you're trying to see if a person has nail fungus or anything else going on with their nail. So first page is going over that. The second page is really interesting because, as you can see, the lab lists each species or each type of fungi and yeast that they test for. So it's a pretty big list. You've got Trichophyton, Microsporum, Fusiform, and Aspergillus. The name goes on and on and on and on. For this person, samples of their left and right nail tested positive for Trichophyton rubrum, which is actually the most common cause of nail fungus infections. But nothing else came up. So I also told this patient, good news. Your infection isn't super complicated. It's one type of fungus. It's the most common fungus. So ideally, this will be very easy to treat. So especially before you start something like oral antifungals or laser, it's definitely important to have a biopsy done. Because again, the last thing you want to do is take medication or pay for a laser package and you didn't have fungus in the first place. Whether you see me, whether you see another foot doctor or podiatrist, make sure that a biopsy is done so that you know and your doctor knows exactly what you're treating and your plan to go about treating it. So that is it. That's how you tell the difference if this is fungus or if this is something else. So let me know in the comments below. Have you been dealing with nail issues, nail changes for a while? Did it turn out to be fungus or something else? How are you doing if you decided to go down any type of treatment protocols with a doctor? If you like this video, give me a like. If you'd like to see more content from me, feel free to subscribe and hit the notification bell so that you will always be notified whenever I post a new video. I also will leave links to a blog post about this topic, and then also my email newsletter as well as my practice site will all be in the description below. Take care and wishing you good health. Bye.